I'm sure you have a lot of questions about this drug, especially if it has been prescribed quite recently. This video will look at the most commonly asked questions in practice and tips to reduce side effects. Up next. I'm Dr. John, and this is Think Your Health. I'm board certified in internal medicine as well as geriatric medicine. This channel is here to promote your health and well-being. What is Seroquel? Seroquel is a prescription medication and belongs to a class of drugs called antipsychotics. It is a second-generation antipsychotic drug. The generic name is quetiapine. What is Seroquel used for? This medication can be used to treat bipolar disorder, schizophrenia, as well as depression, and treatment-resistant OCD. These are the main indications for Seroquel, but the medication can be also used off-label for psychosis and agitation associated with dementia, ICU delirium, generalized anxiety disorder, delusional infestation, post-traumatic stress disorder, and psychosis in Parkinson's disease. How is Seroquel taken? There are two forms, a regular release tablet and an extended release tablet. The regular release tablet can be taken with or without food. The extended release tablet should be taken whole. Do not bite it or chew it. It can be also taken on an empty stomach or with a light meal. A light meal is defined as a meal having less than 300 calories. Here I've listed the most common forms. I won't go into detail about the doses and uses for the different pathological indications, as there are too many variations and dosage changes. You can discuss these with your prescribing healthcare provider. Generally, you start with the lowest dose and titrate gradually up, monitoring for effect and response to treatment and monitor for side effects. How does Seroquel work? Seroquel is thought to rebalance the levels of at least two neurotransmitters, dopamine and serotonin. By rebalancing these two neurotransmitters, Seroquel helps with your mood and behavior, and even in the way you think. All drugs have side effects. Some individuals might experience no or only mild side effects. Other individuals might experience moderate or even very severe side effects. I can only list the most common and talk to your pharmacist or healthcare provider about any concerns or questions you might have. What are common side effects? Orthostatic hypertension, fast heart rate and tachycardia, increased cholesterol, increased triglycerides, weight gain, drowsiness, agitation, headache, increased blood sugars, constipation. 10 tips you need to know before taking this medication. Number 1, this medication can cause side effects referred to as anticholinergic side effects. What does this mean? You may experience constipation, urinary retention, dry mouth, or dry eyes. In some older adults, it might even lead to cognitive dysfunction, confusion. This increases the risk of falls and injuries. You'll be at a high risk to experience these side effects, especially if you're older, have multiple disease entities which are being treated, and are on multiple medications. I'm always quite reluctant to start these medications in an older adult, and you need to have a conversation with your healthcare provider discussing risks versus benefits. You would have noticed when I mentioned the side effects previously that your lipid profile, especially your triglycerides and cholesterol, are affected. Make sure that your healthcare provider gets a lipid panel at least yearly while you're on this medication. Number 3, your blood sugars can also be affected, especially if you're a diabetic. Check your blood sugars and have your hemoglobin A1C checked at least annually. Number 4, I do check your blood chemistries at least annually while on this medication. This would include your liver parameters, kidney parameters, as well as electrolytes, and a thyroid function test called TSH. These parameters can be in some cases affected. For example, low thyroid function such as hypothyroidism can be seen, although it's a rare side effect. Number 5, especially in older adults, they are at a higher risk for falls. Your blood pressure can drop, so take your time when you're getting up from a sitting position. Be careful when you're going up or downstairs. Number 6, it is also recommended that you get a blood parameter check called CBC. In some patients, less than 2%, your white cell count can be affected, causing it to go down. This condition is called neutropenia, and you would be at an increased risk for infections. Number 7, is Seroquel used as a sleeping pill? This is a question I often get. As you would have noticed, one of the side effects of Seroquel is drowsiness and fatigue, and this medication should be preferably taken in the evening. However, per FDA, it is not to be used as a sleeping pill. Some healthcare providers do use it off-label to treat insomnia. Number 8, some individuals, especially older adults, are at an increased risk for extrapyramidal side effects. What does that mean? Some of these side effects you might see are stiff muscles, tremors, involuntary facial movements, involuntary muscle contractions, and inability to sit still. These reactions are seen in about 1 to 13% of cases and are usually dose dependent, meaning the higher the dose, the higher the chances of side effects. Number 9, antipsychotic drugs such as Seroquel can cause erectile dysfunction and decrease libido. Beware of this when you're on this medication. Number 10, in our practice, we do check an EKG on every individual on this drug. This drug can cause a rare change seen on your EKG called QT prolongation. This can increase the risk of heart arrhythmias called Torsades de Pointes. Bonus tip: when you're discontinuing this medication, do not suddenly stop the medication. The medication should be tapered off to prevent discontinuation symptoms and rebound symptoms such as insomnia, sweating, dizziness, feeling nauseous or tearful. Here are more videos which can help you with mood stabilization. Check them out. Think your health and have a good day. Let me try the end. What is Seroquel used for? I can't say OCD. I can't believe at this moment my son has to get up and start walking around. It always happens. Murphy's Law.